Hello, everyone, and welcome to our workshop titled Vermont Resources When Navigating the Confusing World of Genetics with Dr. Leah Burke, clinical geneticist and professor Emerita at the UVM Larner College of Medicine. Vermont Family Network has been serving families of children with special health needs and disabilities and the professionals who serve them for more than 30 years. We are the federally designated Parent Training and Information Center, the Family to Family Health Information Center, and the Vermont chapter of both Family Voices and Parent to Parent USA. I'm excited to introduce you to Dr. Leah Burke. Thank you so much for joining us today.
So I'm Leah Burke, and I'm very pleased to be here and going to try to sort of navigate our way through if you're getting genetic resources, how does that happen? So these are the questions that I will be trying to answer for you. The first is where are genetic services located in Vermont? Is genetic testing expensive, and so how can I afford the genetic testing? And is it covered by insurance? And then what happens if it's not approved by insurance? And then finally, what resources are available? You'll be getting other recordings about some of these resources, but I'll touch on that as well. So first of all, where are genetic services located in Vermont? Well, all of the geneticists and genetic counselors are physically located in Burlington at this point. However, even before COVID, genetic counseling sometimes took place by telemedicine, and since COVID, most of the genetic counseling appointments are done remotely. This allows multiple family members to participate in the genetic counseling, and it really has worked out quite well. For people who need evaluations, they need to come to Burlington for that first medical evaluation. However, some of the follow-up can also be done remotely. So most of the genetics in Vermont is done at the UVM-MC Clinical Genetics Program. Currently, there are 2 geneticists there. I was previously there and recently retired from clinical work. The geneticists there now are Dr. Katie Anderson, who directs the program, and Dr. Bob Wilden. The genetic counselors there are Denise Banyan and Christine Jimmo. There are a couple of other areas that have particular genetics programs that are different from the general program. One of those is the familial cancer program. These are genetic counselors who work directly with the hematologists and oncologists and do primarily adult cancers such as breast cancer and colon cancer. There are 3 genetic counselors there, Wendy McKinnon, Laura Colello, and Colette Hyatt. And they either do their work remotely through telemedicine or meet with the person or family when they come for a visit to the familial cancer program for medical care. In obstetrics, there is a geneticist who does much of the testing there. However, there are no genetic counselors in obstetrics, so the prenatal and preconceptional counseling and other counseling that might occur in obstetrics other than the cancer counseling is done at the cancer program, the center with Dr. Katie Anderson and the genetic counselors there. So the big question, is genetic testing expensive? Well, it sort of depends upon your point of view. So it certainly has gotten cheaper. This is a graph that the NIH, the National Genome Research Institute, puts out periodically. And you can see up here, it was over $100 million was the whole genome project when they sequenced the first genome. And right around here, there was a technique that was discovered that could massively parallel or do lots of genetic sequencing at the same time. And the cost fell because of that. Now, this is the cost of a genome, what it costs the lab. which you can see is about $1,000. And then you say, well, then it must cost a lot less to test just a few genes or a group of genes. That's not necessarily true, because you have to remember, first of all, this is the cost to the lab. So that's more sort of the reagents that they use, the machines that they use. It's not the cost to the individual or to the insurance company. So genomes, which aren't done very often, are still much more expensive than that, but the price keeps going down. When you're talking about individual genes, sometimes it's much more specific and labor intensive to do the group of genes than it would be to just sequence the genome without a lot of interpretation. So I would say that now many genetic tests and panels can be done for around $1,000, some of them much less expensive than that if they're specific genes and a lot is known about them. But it's still a lot of money for people who are trying to care for a child with special needs. And that's where insurance comes in. So is genetic testing covered by insurance, and therefore how can I afford the genetic testing? The first thing I would emphasize is that genetic testing, by and large, needs a prior authorization. It's not a test that your doctor can just order from the office, with a few exceptions, and have the insurance pay for it. Many times insurance companies want to know that you've had pre-test counseling, or they want to know that a geneticist or a genetic counselor has been involved in the decision about the testing. And prior authorization just looks at the specific test. Now you will notice on this form that there are specific genetic tests that are listed. This is the state of Vermont for Medicaid, and you can see some of the tests that are done on adults, like BRCA 1 and 2 and colon cancer testing, are ones that you can just check. And when you get into this area, these two are probably the two that are ordered most often for children. Fragile X syndrome is a syndrome that involves intellectual disability and occurs mostly in boys. And whole genome microarray has largely replaced the chromosome study or karyotype that was done in the past, and it looks for sections of DNA that are missing or added. These two studies are the ones that are most commonly done in children with developmental delay or autism. But you'll see that the person filling out this form has to know a lot of codes and descriptions in order for that prior authorization to go through. So it's very important to have your geneticist, genetic counselor, or your physician who's filling out this form be aware that they need to have all that information. The second page of this has a lot of questions that really determine whether or not it's going to be covered. So why is the test appropriate for the patient? In other words, are you just shooting in the dark, or do you have a reason for doing that particular test? Sometimes they want to know that there are actually clinical features for the condition that you are testing for. This is a double-edged sword, because some conditions are diagnosed primarily on their clinical features, and if a person has every single one of those clinical features, sometimes an insurance company will say that the test is not needed because you have already made the diagnosis. This has been true for a condition called neurofibromatosis, because if a person has enough of the features of that condition, they already have the diagnosis. And so there needs to be another reason. However, if you have a baby, for instance, who has multiple brown spots, which is one of the first signs of neurofibromatosis, you don't know whether that baby is affected or not. So therefore, you can say, yes, they exhibit clinical features, but not enough to make the diagnosis, and the test will help with the care of that child, because you will get the services that they need in case they do have that diagnosis. This is an important one. Has the patient given informed consent to the genetic test? For most places, genetic testing does require consent. Sometimes in emergent situations, if it's done for diagnostic purposes, that is not the case, but we try to always make sure that informed consent is part of the procedure, because we want to know that the family understands what the test can show, what it can't show, and what that means for other people in the family. And part of that is genetic counseling. This validity of testing and the testing scientifically sound. This is a little bit more difficult one, because the testing is changing so rapidly. So that's where having some literature to support the decision, saying that yes, it's helped diagnose and help get services for patients, is helpful. Now, is the patient willing to undergo the increased interventions that may potentially be required because of the testing? In other words, the insurance company wants to know that if the family is going through that testing, does that mean that they will actually get the care that is recommended for that condition if the testing is positive? And then specifically, how will the results impact or alter medical management? You have the cost of the test, and then this is an interesting one that has come up. Is multi-gene panel testing more cost efficient than combined reimbursement for single codes? The insurance companies are realizing that doing a panel that involves a lot of different genes means that the company can actually do it more easily than testing for a single gene. The other side of that is that we're finding out that many conditions overlap symptoms, and therefore there may be several conditions that you are considering at the same time. Okay, so I wanted to take you, that was the Medicaid site. And in Vermont, Blue Cross Blue Shield is also a very large insurer of individuals. And I wanted to take you to this site to show you what they consider genetic testing for particularly developmental delay, intellectual disability, autism spectrum disorder, or congenital anomalies. And this is like birth defects. So they have already reviewed the literature for these conditions, and that means that they have come up with their policies. And in this policy, I won't go through the whole thing, but they consider the chromosomal microarray analysis to be sort of the first step. And it goes through not only chromosomal microarray, but you can also see that the next generation sequencing panels, which are those multi-gene panels, is also being considered. So many of the insurance companies already have policies. So sometimes the prior authorization is pretty simple. Just you have to put in, you have to give the clinical features, and then it's approved. Now, what happens when it's denied? Because certainly we get a lot of denials for genetic testing, and I think that's true of any new technology, and genetics changes so very rapidly that it probably occurs more there than other testing. And so this becomes a real challenge for a lot of people, including the practitioners, the genetic practitioners, as well as the families. So there are methods for appealing denials, and they are present in all insurance policies, Medicaid as well as private insurance. So these are put out by the Patient Advocacy Foundation, and they're common denial reasons for procedures or testing. And I'm going to start with these two. The services were considered experimental or investigational for your condition, and the treatment you were prescribed is not considered medically necessary by your insurance plan. These are the two that are probably used most often to deny genetic testing. And the first one, the experimental or investigational, is again where your physician can provide evidence that it is not experimental or investigational for your condition, that it actually does give a diagnosis. The considered medically necessary, one of the catchphrases that is very important to remember is ending the diagnostic odyssey. So the diagnostic odyssey means that for children with a lot of special health needs and children who have genetic conditions, often the diagnosis takes a long time. It takes a lot of testing. Some of that testing is more expensive than genetic testing, like multiple MRIs or even one MRI sometimes. And so saying that this will end or has the potential of ending the diagnostic odyssey has actually been accepted by many insurance companies as being one of the medical outcomes that is beneficial to the patient. One of the other medical benefits that can come about through genetic testing is access to clinical trials. So the new medicines for all these conditions are being developed, and they all have clinical trials, obviously, to decide whether they're safe and whether they work. And they do not want people in those clinical trials who do not have a definitive diagnosis. And for genetic conditions, that usually means that they have a positive genetic test. So medically necessary, it doesn't mean that all of the treatment would automatically change. In some cases it will, but in other cases it gives a diagnosis that ends the odyssey for the parents and gives them support groups as well as access to clinical trials, support groups that are specific for their conditions. And those are considered medical benefits of testing. So if you have traditional Medicare, which most children don't, the process for appealing is similar to commercials. If you have Medicaid, all state Medicaid programs are required to have a process for their members to appeal. The appeal rights are established federally, so they all have to have it. And you can find out about that by going to the Medicaid website. So one of those ways of appealing is to request what's known as a peer-to-peer. So a peer-to-peer involves a discussion between the prescribing provider and the medical director of an insurance company. So the prescribing provider may be the geneticist or genetic counselor who suggested the genetic testing. It may also mean another specialist, a neurologist, an endocrinologist, or even the primary care physician. And they, with your permission, share medical and treatment history, details about the diagnosis, and why they feel prescribed. So the medical director that the peer-to-peer review involves can use their own judgment, and they can overturn the denial sometimes immediately at that stage. Some insurance companies have a tiered approach to peer-to-peer as well. The first peer-to-peer is actually not with a medical director, but with perhaps a nurse or a doctor outside the genetics field who has been hired to do these peer-to-peer reviews. So if you're denied by that step, you need to request a peer-to-peer review with a specialist in the field. So with a geneticist or genetic counselor who knows genetic testing. So peer-to-peer reviews are time-consuming because the insurance company is much like the cable guy. They give you a whole range of time that they can call you. So it's difficult for the practitioners to do peer-to-peer review because they have to sort of block out a period of time when they can do these. And sometimes the insurance company people don't call during that time. But it's still a good way to have a denial reversed. And so it's important to advocate for those peer-to-peer reviews. Sometimes it's just simply that they didn't read the PA, the prior authorization form completely, or didn't read the clinical information completely. And I've had peer-to-peer reviews where the reversal is really automatic. It comes moments after we've gotten on the phone. So this is the Vermont official state website, and you can see that it says that if you do not agree with the decision, you can ask for an internal appeal. Now, internal means that's within Green Mountain Care. And most of the peer-to-peer reviews, the denial appeals, are all internal appeals. You can ask for it to be expedited, which is faster. And we often do that for kids who are sick and in the hospital, and we really need to know the answer to the genetic testing. And there are suggestions on here about, how to get an internal appeal going. You can request an internal appeal. It does not have to come from the physician who ordered the test. So the family can also request an internal review, internal review. An external appeal is when you don't agree with what your insurance company, and you actually go to the State Board of Insurance and say that they were not fair. That's also available to families and individuals, but it's a kind of a higher level, and you need to start with the internal appeal. So one of the other reasons is that it is not a covered benefit or a listed exclusion. So there are insurance companies who simply state that they do not cover genetic testing. If they state that they do not cover genetic testing, it is, I never say impossible, but it is very, very difficult to overcome that. And that is a clause that the company who is insuring you, so your employers, decide that that's an okay exclusion to have, because it's not the entire insurance company, it's the policy that the employer decides to have for their employees. The other one is that it's a listed exclusion. So sometimes an insurance company will not say that the genetic testing is not covered, but they have an exclusion for some of the particular CPT, which are the billing codes for particular tests. And there are ways of getting around that within the testing companies. There are some testing companies that have several different billing codes that they can use, and if they simply use a different billing code, it sometimes goes through. You should know that some of the genetic testing companies take on the prior authorization process themselves, rather than having it go through the institution that ordered the testing. And they have gotten very good at talking to insurance companies. So sometimes that actually works better to have the testing company. They have a vested interest in getting it covered. If there is an exclusion, however, there is a way that you can get an exception. This is the form again from the Vermont Health Access, and this is one that the beneficiary or the person or family would fill out. There's another form very similar to this that the ordering physician can fill out, and it's a request for Medicaid coverage exception. And this is an important question. How will you be harmed without the service or item? And I have filled out these coverage exceptions and gotten them approved. We have done it for particular formulas that are needed for conditions that have dietary needs, because the person has already tried the formula that is approved, and so they don't tolerate it, and so you get an exception to have another formula approved. And the same thing can happen with genetic testing. Although you really need to show that there is a medical reason for that testing in order to get an exception. So again, this is from the Patient Advocacy Foundation, and they kind of listed out as you see here. If you have a denial, you need to determine the reason. That's very important. It must say on the denial what the reason is. So is the reason that it is excluded? Is it that they don't think the patient or you have the symptoms that would warrant that testing? Why was it denied? And then you also need to pay attention to timelines. Sometimes there's only 30 days that you can appeal a denial. So pay attention to the letters that come from the insurance companies so that you know when it was denied and what the timeline and deadline is for submission for an appeal. It's very important to contact the doctor for support because they can write an appeal letter as well. And supportive documentation is also very important. Sometimes this is just more clinical information. Sometimes this is actually some scientific papers that support that. And then verify that they actually have received the appeal and it's being processed. And then, as they say, if approved, congrats. It's always a good feeling if you get a denial reversed. And if it's denied, then you should have in that denial letter what the next level of appeal is. So now I want to talk a little bit about resources available. And I should say before I go to this that one of the resources that's available for genetic testing is from the companies doing the testing themselves. Most of them have an out-of-pocket limit so that if a person has been denied by insurance and they are looking at paying out-of-pocket, the cap that they have for people paying out-of-pocket is often much less than the actual cost of the test. So that you can sometimes have a $100 or $250 cap and do the testing directly with the company. And you should be able to have the geneticist or genetic counselor help you set that up. But so the individual genetic testing companies do have help to get things paid for. The other thing is that if you have the test go through a medical center, the medical center has payment plans. And if you go directly with the testing company has payment plans as well. So if you have to pay out of pocket, there are ways to have that amount be less. Then in addition, I know that you all know this, but there is support from the Vermont Family Network. And they provide support for funding, making referral, individualized support. Some of that is financial and the rest is the other great support that they do. But you can contact the Vermont Family Network for that. And then there are national organizations. There's an organization called NORD, or National Organization of Rare Diseases. And if you go to their website, there's a lot of information. They're mostly an information site, but they also provide support. So if you look under patients and families, there's a lot of rare disease information, video libraries, resource centers, and then there's also help to access medications or other financial assistance. So if you look at the other financial assistance, you can apply for their patient assistant program. If you go under, again, the family, patients, and rare disease information, then there's a database that can give you information, which also can lead you to support groups that can provide information. And I'm sorry, I skipped over the patient assistance program. The patient assistance program has been very helpful for children who need certain medications, certain formulas. They can also provide other. You need to open each one to see whether or not it is available to the patient that you're thinking about, either you or a family member. You can see that under autism, the clinical trial where they pay for travel and lodging, the study is closed, so they no longer pay for it. But if you go under some of these others, you can see that there's undiagnosed, and it gives you where to get assistance for getting your child or family member evaluated through the Undiagnosed Disease Network. And if you look under one or the other, they can provide travel and lodging for a clinical trial. Much of it is that kind of assistance. PKU, they provide a lot of different assistance, including copay assistance. And that's because PKU in particular and some of the companies involved with PKU have made these agreements with NORD. But NORD is a very good resource for individuals with rare diseases. And then if your child does not have a diagnosis, then you might try looking at the GEMS for Schools. So GEMS for Schools was set up to provide education materials for families and for schools. And that it's organized under conditions. And many of the conditions are listed, or all of the conditions are listed here, and they're specific conditions. But if you look here, the undiagnosed medical or developmental conditions also gives you some information about how to manage that journey. And so under general tips and strategies, there are some general guiding principles. There's talking about what an IFSP, IEP, or 504 plans. There's a lot of information here, even if your child does not have a diagnosis. So I would recommend just sort of going through the GEMS website. It's now housed into the New England Regional Genetics Network website, but you can get to it directly by this just gemsforschools.org. So with that, I will finish, and I will stop sharing. Thank you very much.
Thank you so much, Dr. Burke, for today's informative workshop. Gosh, I learned so much today. We really appreciate your time. So for those watching, you will see a link to an evaluation for this workshop on our VFN Genetics Series website post. Please take a few minutes to complete it so that we can make improvements and fulfill our grant requirements. We have tons of information and links to many other interesting workshops on our website, which is vermontfamilynetwork.org. You can follow us on Facebook or join our closed Facebook page if you are a parent. The name of the closed Facebook page is Vermont Families of Children with Special Healthcare Needs. You can also sign up for our monthly e-news or check out our YouTube channel. We're here to help, and getting connected with us is easy. Thanks again, everyone, and have a great day.